Smoking is a leading cause of preventable diseases and deaths worldwide. It affects almost every organ in the body, leading to a myriad of health issues. Mark's story is a testament to the profound impact smoking can have on an individual's health and life. At 50 years old, Mark had been a smoker for over 3 decades. What began as a casual habit in his teenage years evolved into a dependency that he struggled to overcome. When he started experiencing persistent coughs, shortness of breath, and fatigue, he realized that his smoking habit was taking a severe toll on his health. Mark's journey toward quitting smoking and regaining his health highlights the critical importance of understanding the dangers of smoking and taking proactive steps to prevent its harmful effects. Types of smoking and exposure. Smoking can take various forms, each with its own set of risks. Cigarette smoking, the most common form, involving the inhalation of smoke from burned tobacco wrapped in paper. Cigar and pipe smoking, often perceived as less harmful but can be equally detrimental due to the high levels of toxins. Secondhand smoke, non-smokers exposed to smoke exhaled by smokers or from the burning end of cigarettes are also at risk. Third-hand smoke, residual nicotine and other chemicals left on indoor surfaces by tobacco smoke can pose risks, especially to children. Electronic cigarettes, vaping, involves inhaling aerosol produced by heating a liquid that usually contains nicotine. Long-term health effects are still being studied. Epidemiology. Smoking remains a significant public health issue globally. Global prevalence. Over 1.1 billion people worldwide smoke tobacco, according to the World Health Organization. Deaths attributed to smoking tobacco use is responsible for more than 8 million deaths per year globally, including about 7 million from direct tobacco use and 1.2 million from secondhand smoke exposure. Youth smoking. A significant number of adolescents begin smoking before the age of 18, increasing the risk of prolonged exposure and health complications. Gender differences. Historically higher in men, but the gap is narrowing as smoking rates among women increase in some regions. Several factors contribute to smoking initiation and continuation. Nicotine addiction is a huge one. Nicotine is a highly addictive substance that leads to dependence, making quitting really difficult. Then there are psychosocial factors. Peer pressure, especially among adolescents and young adults, plays a significant role. Some individuals use smoking as a way to manage stress or emotions, kind of like a coping mechanism. Advertising and media influence can also glamorize smoking, making it seem more appealing. Genetic predisposition is another factor. Genetics may play a role in susceptibility to nicotine addiction. And lastly, socioeconomic status. There's a higher prevalence of smoking in lower socioeconomic groups due to factors like stress, accessibility, and targeted advertising. Smoking affects nearly every organ, leading to numerous health issues. Let's start with the respiratory system. The lungs suffer greatly. Chronic obstructive pulmonary disease, or COPD, includes emphysema and chronic bronchitis, causing airflow blockage and breathing-related problems. Lung cancer is another major concern, with smoking responsible for about 85% of cases. Mark was diagnosed with early-stage lung cancer, which served as a wake-up call. Asthma can also be triggered or worsened by smoking, and there's reduced lung function due to inflammation and narrowing of the airways. Moving on to the cardiovascular system, smoking can lead to heart disease. Coronary heart disease occurs when smoking damages the lining of arteries, leading to a buildup of fatty material and increased risk of heart attacks. There's also an increased risk of stroke due to blood clots. Peripheral arterial disease, or PAD, involves the narrowing of the arteries, reducing blood flow to limbs. The brain is affected too. Nicotine alters brain chemistry, reinforcing the smoking habit and leading to addiction and dependence. There's also an increased risk of cognitive decline, dementia, and cognitive impairment. And as mentioned, stroke risk is higher due to clot formation. The eyes are not spared either. Smoking increases the risk of cataracts, which is the clouding of the eye's lens, and age-related macular degeneration, or AMD, leading to vision loss. Uveitis, which is inflammation of the eye's middle layer, can also occur, potentially leading to vision loss. Other organs and systems are impacted as well. In the mouth and throat, there's an increased risk of oral cancer, including cancers of the lip, tongue, mouth and throat. Gum disease can also develop, leading to periodontal disease and tooth loss. The digestive system is affected, with an increased risk of stomach cancer due to damage to the stomach lining and pancreatic cancer, for which smoking is a significant risk factor. The reproductive system is not immune either. For men, smoking can lead to erectile dysfunction and reduced fertility. For women, there's reduced fertility, complications during pregnancy, and an increased risk of cervical cancer. The skin shows signs of premature aging, such as wrinkles and skin discoloration, and there's an increased risk of psoriasis. Bones are weakened by smoking, increasing the risk of fractures, known as osteoporosis. And finally, the immune system is compromised, leading to reduced immunity and making the body more susceptible to infections. Secondhand smoke is dangerous too. For children, there's an increased risk of sudden infant death syndrome, or SIDS, respiratory infections and asthma. Non-smoking adults aren't safe either, as they face a higher risk of heart disease and lung cancer just from being around smoke. Detection and diagnosis. Early detection of smoking-related health issues is crucial. Medical history and physical examination. Discussing smoking habits openly with healthcare providers. Pulmonary function tests. Assess lung capacity and airflow obstruction. Imaging tests, chest X-rays can detect lung damage or tumors. CT scans provide more detailed imaging to identify early lung cancer. Laboratory tests. Spirometry measures breathing capacity. Biomarkers test for cotinine, a nicotine metabolite, to assess exposure. Cancer screenings, low-dose CT scans are recommended for long-term heavy smokers to detect lung cancer early. Prevention strategies. Preventing smoking initiation and promoting cessation are key. Education and awareness. Public health campaigns highlight the dangers of smoking. School programs educate youth about the risks. Policy measures. Tobacco taxes increase prices to deter purchase. Smoke-free laws ban smoking in public places. Advertising restrictions limit tobacco marketing. Access to cessation programs. Counseling services provide support and resources. Quitlines offer telephone-based counseling. Nicotine replacement therapy includes patches, gums, and lozenges to help reduce withdrawal symptoms. Prescription medications like bupropion and varenicline aid in reducing cravings. Community support. Support groups allow sharing experiences and strategies. Family and social support. Encouragement from friends and family to quit smoking. Treatment options. Overcoming nicotine addiction often requires a multifaceted approach. Behavioral therapy, cognitive behavioral therapy or CBT, identifies triggers and develops coping strategies. Motivational interviewing enhances motivation to quit. Medication nicotine replacement therapy gradually reduces nicotine dependence. Prescription drugs, as mentioned, include bupropion and varenicline. Combination therapy, medication and counseling increase the likelihood of successful cessation. Alternative therapies. Some find hypnotherapy and acupuncture helpful. Regular follow-up healthcare provider visits monitor progress and address challenges. Relapse prevention. Identifying high-risk situations and planning ahead to avoid relapse. Ongoing support. Continuing engagement with support groups or counselors. Mark's path to recovery. Mark's decision to quit smoking was pivotal. Acknowledging the problem, the diagnosis of early-stage lung cancer prompted immediate action, seeking professional help. He underwent surgery to remove the cancerous tissue and enrolled in a structured smoking cessation program. Nicotine replacement therapy. Nicotine patches helped manage withdrawal symptoms. Behavioral support, counseling sessions addressed psychological dependence, and support groups connected him with others on the same journey. Lifestyle changes. Mark began walking daily to improve lung function, focused on an antioxidant-rich diet to aid recovery, and practiced meditation and deep breathing exercises for stress management. Family support. Open communication with his family provided encouragement and accountability, and creating a smoke-free home environment was conducive to quitting. Monitoring health, regular checkups tracked lung health and detected any recurrence, and he participated in pulmonary rehabilitation programs to enhance respiratory function. Over time, Mark noticed significant improvements. His breathing became easier, energy levels increased, and his senses of taste and smell enhanced. Quitting smoking not only improved his physical health, but also his overall quality of life. Conclusion. Mark's journey underscores the severe health risks associated with smoking and the profound benefits of quitting. Smoking affects nearly every organ, leading to numerous diseases and health issues. However, with determination, support, and appropriate resources, overcoming nicotine addiction is possible. Awareness, education, and proactive measures are essential in preventing smoking initiation and promoting cessation. By understanding the dangers and taking action, individuals can significantly improve their health and well-being.